frequencies. Number one in your heart. Kabayan Radio 94.3.
3 years and counting.
3 years on the airwaves. Kabayan Radio continues to bring you closer to the music you love.
I need somebody who can love me.
To the entertainment you love.
To the information you need.
And to radio advertising you deserve.
Over analog
And multi-digital platforms.
This is Kabayan Radio,
94.3 FM.
the first and the only.
Filipino radio station in Qatar. With more than 257,000 unique audience and more than 60,000 followers, Kabayan Radio, Kabayan Radio 94.3 FM is the best. Is the best marketplace for your advertisements. For inquiries, please contact our sales and marketing department at 44994944 or email info@kabayanfm.com.
Keep listening. Keep listening. Stay where you are. Live, online, on air, and on ground. Kabayan Radio 94.3.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
A wonderful evening. You are tuned in to the first and the only Filipino radio station here in Qatar, Kabayan Radio 94.3. My name is Kenzo, welcoming you to another episode of The Doctor is In. And right now, apart from broadcasting live on our radio frequency, we are also live on Facebook. If you would want to watch us, please do head on to www.facebook.com/kabayan943. And as we start the program, I would like to first acknowledge Gulf Dental Center for making this episode of The Doctor is In possible. And joining us here at Kabayan Radio Broadcast Studio is a specialist from Gulf Dental Center. He had completed general dentistry in 2004, orthodontics in 2009. He has been with Gulf Dental Center as a specialist orthodontist for the past 7 years. Thank you very much for joining us here in the studio, Dr. Anup Rudramurthy.
Hello everyone.
Hello, good afternoon, or good evening.
Good evening, Po. Hi, good evening to all my Kabayan friends. Thanks for inviting us, Kabayan 94.3. Firstly, I like to thank Almighty Allah for showering all the love and peace on us. Thanks to our boss, Dr. Mahmoud Abu Zaina and Dr. Mohammed Robin for giving us this opportunity. Okay, let us start the
Yes, of course. And there are quite a number of discussions that we will be having tonight. We'll be covering general dentistry and orthodontics. But first, I would like to start off this conversation with a very basic question. And I'm sure that many of our listeners and viewers right now already know the answer to this, but I would like this question being answered by a specialist like yourself. So, why do we need to be mindful of our dental or oral health, and why do we need to visit a dentist?
Okay, so as you know, in any other field, like there is something called prevention. Prevention is always better than cure. It might be in dentistry or in any other field. So first, if we prevent that, then we are going to reduce the severity. So same thing holds good in dentistry as well. So if that particular Kabayan or any other patient walks in at least minimum 3 to 6 months once for a general regular checkup, if there is anything to be fixed, we can see that, we can go to thorough examination and then try to fix the treatment plan for that particular person. So my advice is to visit a dentist at least 3 to 6 months once.
Okay, so I was like actually thinking that it would only be like twice a year, every 6 months. But you've mentioned 3 months.
Better 3 to 6 months.
Okay, okay. But usually, what are the things that a dentist would do if I visit for a checkup, like every 3 months or every 6 months?
Yeah, first thing is, as you all know, there is a need for scaling. So in layman terms, we call it as cleaning. So usually there is a deposit of plaque. What is plaque? A plaque is a thin biofilm which is formed in a day. It will be formed 2 layers. So we need to remove this plaque as and when it's formed. So it's very important to teach the brushing technique for the patient, as well as they need to use the optimum pressure to remove this plaque. If not, this plaque is going to get accumulated,
Right.
and it gets into big layer, namely calculus.
Okay.
If the calculus is formed, that cannot be removed by brush, and that person needs to visit a dentist. It has to be removed by a scaler tape. You cannot use the brush to remove that hard deposit
right.
called as calculus.
Right.
So it is necessary for the patients to think about the brushing technique and to remove this one. So
Right.
usually when they come to us, our first preference will be cleaning.
Right.
That is called scaling.
And then you were mentioning about calculus or something that is calcified in our teeth. What usually happens if we allow that to remain? Are there repercussions in terms of our oral health and overall health in general?
Now, if you leave it to progress, first thing is halitosis. So it might lead to bad breath, that is called as halitosis. So in further, if it is left as it is, then it might go to reduce the bone support. So each tooth is surrounded by bones. If this gets accumulated, it slowly reduces the bony support of the tooth, and ultimately your tooth is going to mobile. Ultimately it might fall by the very early age. So that is the need. We need to remove that periodically.
Right.
It's just like cleaning the floor. You need to maintain that. As simple as that. Same thing holds good for your teeth. You need to have a right brush, right technique for the
Right.
cleaning, and optimum pressure has to be done.
What do you mean by optimum pressure?
So there is something called optimum pressure. So the bristles should be soft. For example, the toothbrush should be, we recommend a soft bristle brush.
Okay.
If it is hard, it is going to create, there is something called cervical abrasion. Many patients I do see, they will be having sensitivity. It is caused by them because of hard brushing. And in course of time, it might need to go for a pasta or filling. So that's called optimum pressure.
Okay. Okay.
So it should not be more or it should not be less.
You shouldn't also be brushing your teeth very hard. It can also affect the enamel.
Exactly, that's what. The chipping off of enamel at the neck region of the tooth is called as cervical abrasion.
Okay.
Which is caused by the patient himself because of over pressure.
Right. Going back to the calcification, the calculus, is this something that we might be worried about? Because I've read something about having some cardiac manifestation if you allow this to progress.
Yes, you are right. So now there has been many scientific studies wherein there is a relationship of heavy deposits and the cardiac manifestation. Let me explain you how. If a person has so much of deposition, like calcular deposition in his oral cavity, then automatically it will attract more number of microorganisms.
Okay.
So if there is too much of microorganism, it gradually enters into your body and causes all these cardiac related problems. So ultimately there is a like proportionately
Right.
the cardiac problem is directly proportional or related to the oral cavity. If
Okay.
the oral hygiene is not good, of course he has a definitive chance of cardiac manifestations.
Okay. All right. That's good to know. So that's of course going to be removed. The calculus can be removed by scaling. How about the polishing? What does it do to our teeth?
Yeah, polishing is something which we usually do after cleaning, wherein we use a pumice powder. So it's just to remove the micro surface, micro hardness or micro scratches that has been created,
see, okay.
and to remove that minute tiny tartars that is deposited. So we use that polishing powder which sprays on that, which cleanses that. So in general it reduces the micro scratches.
Okay. So
That is
these are
called
the,
as polishing.
yeah, these are the two common things that we
Yes.
usually get for cleaning.
Yes.
How about bleaching? I mean, is this something that is done for aesthetic purposes, or does it have any other purpose rather than apart from aesthetic purposes?
Yes. Now bleaching is something called, it is mainly done for the cosmetic purpose, and it has no relationship with the functional.
All right.
So people mainly demand that their tooth is bit more of yellowish. So in these circumstances we advise them bleaching.
Okay.
So what is bleaching? Bleaching is just like a skin bleaching, wherein we do tooth bleaching. So we use some chemical agents like 10% to 20% of hydrogen peroxide. So we give precautionary measures to the patient.
Right.
We explain the treatment plan, treatment procedure in prior, and prepare them. So now when these chemicals they enters the tooth, it slowly reduces the discoloration. So it becomes more of whitish. From yellowish you can see the changes
Right.
within
right.
45 minutes to 1 hour.
Right, but isn't that going to be hard to undergo such treatment?
Not necessarily. It's not hard. Of course, it depends on the patient threshold
Yeah,
level.
because I was like thinking maybe your teeth will be very sensitive afterwards, especially after the chemicals have bleached your teeth. Like for example, when you are bleaching your skin, sometimes it can get irritated. Does that happen with our teeth as well?
Of course, yes. So usually patient may experience a slight sort of sensitivity. Again, the threshold level depends on the individual threshold level, pain threshold. Not necessarily all the patients will have too much of sensitivity, but I say yes, they do have sensitivity, but we give some desensitizing paste or we give some precautionary measures to reduce that.
Right.
And of course, this sensitivity is not for long term.
Right.
It may last only for few
hours.
days
Or
or
few days, yeah.
hours.
Okay, okay. So that's good to know. So now, of course, when we are going to a dentist, apart from cleaning and maybe bleaching, what else do we expect when we go on a regular visit to a dentist?
You can go for a pasta. Usually the next common problem will be pasta, that is filling in our terms. So we usually we detect the dental caries. So caries is something which is chronic. Chronic means it build up over a long time. It's not like yesterday you saw the caries and tomorrow it is painful. Not like that. It's a slow procedure wherein it gets accumulated. Slowly it keeps progressing. So at one particular point, when it reaches the pulp, it is going to start pain.
Okay.
So at this area, we need to stop it. So it's very important to see that there is a dental caries. We need to remove it thoroughly, and
Right.
that empty space in the tooth has to
Yeah,
be
to
filled
fill.
by composite. That is
Right.
pasta.
Right, right. Are there any different types of filling?
Yes, of course. We were using earlier silver amalgam,
Right.
but now in Doha, it's not recommended here. So now we are using only composite materials.
Only composite.
Only composite
Okay.
materials, which is very much matching with the color of the tooth.
I
So
see.
they cannot differentiate between the pasta material and tooth surface.
And usually, how long does a composite filling last?
Yeah, that's one more good question. So now usually if we detect in the early stages, if the pasta material is very less, it is going to stay for more than 5 years.
Okay.
Depending on the condition. If it is already decayed, if it is more involved of the tooth, if the tooth structure is less, it may not last for a long time. In that scenario, we usually tell to patient prior, for this pasta, we will show them. We will show the tooth preparation or cavity preparation. We will show them that this is the condition. So this might last for so many days or months or years.
Right.
So we
right.
can predict that prior.
Okay, that's good to know.
Henceforth, we recommend early detection and early fixing.
How about having an X-ray? Is it something that is advisable, like once a year when you go for a general checkup?
Yes. Now, coming to the X-ray part, as and when a patient walks to me, we first advise oral pantogram, that is called OPG. It's a big X-ray wherein all the teeth present in the patient mouth as well as some bony structures like maxilla, mandible and condyle, nostrils, all those are visible.
Right.
Now, the main advantage of taking a X-ray is, I mean, to be more specific, OPG is, we can identify any other defects that is underlying. For example, there might be a cyst, there might be odontoma, there might be some pathological conditions.
Or impacted tooth.
Yes, of course, wisdom teeth, impacted wisdom teeth. All these can be detected with the OPG. So that's the main reason when a patient comes to our clinic, first and foremost thing, we advise for a X-ray.
So that's only for the initial part. But
Yes.
do they have to do it like once every year or once
Not
every 2 or 3
necessarily,
years?
not
something like that?
necessarily, not necessarily. You have to go for OPG all the time. For example, if we are doing any particular small, like root canal treatment or something like that, we take a specific X-ray. That is a small X-ray, which is also called as IOPAR. So this is a small X-ray which covers only 3 teeth or that particular teeth which is required.
Okay.
It may not cover all the teeth. There is also bite wing.
I thought that if you do an X-ray, it's like for everything. So you can do like for specific or targeted areas.
Targeted area. If we are doing any treatment to some particular teeth, we are going to take a small X-ray called as IOPAR.
Right, right. I would have to ask this question because sometimes when I do brush my teeth, my gums are bleeding. So are there like what are the reasons on why we have like very sensitive gums?
Yes, this is again a most common problem we face. So there are n number of reasons for the bleeding gums. But now let me discuss mainly the bleeding gums because of the calculus deposit. In most of the cases, the reason for etiologic factor for bleeding gums is the calculus. So once there is a deposition, automatically there will be inflamed gingiva. The gingiva that is called gums, they get inflamed. And when we touch that inflamed gingiva, automatically there will be bleeding. So we need to remove the etiologic factor, that is the causative factor, and then fix it. So slowly within the span of 2 to 3 weeks, after thorough in-depth cleaning and as well as polishing, automatically along with that we use some gum astringent for the gum massage, so that slowly this will come down and there will be remineralization of all the teeth and inflammation slowly subsides and it reduces the bleeding gums.
Right. And does it also have to do with someone brushing their teeth or their teeth a little too hard?
Of course, in some cases I do see because of excessive hard bristles, that is called as traumatic brush. Because of trauma, because of the bristles, hard bristles of the brush, it might hurt your gums and it might bleed. So to stop that, you need to go with the either soft medium bristles or soft. Soft bristles is most recommended one.
Would you advise people to use a mouthwash?
Of course, yes. We need to go with the mouthwash, especially after your meals. After your each meal, you need to go with the mouthwash. So as I said earlier, this particular mouthwash removes the debris. Along with that, it helps to reduce the micro thickness of the plaque. So we need mouthwash which contains fluoride is much more recommended.
Okay, so something that contains fluoride.
Fluoride, yes.
Okay. Are there some types of mouthwash that they should be avoiding?
No, nothing like nothing. There is no mouthwash that has to be avoided. It's preferably to go with the mouthwash which contains fluoride.
Right. Okay. What about the common mistakes that people make when about taking care of their oral health?
Okay, this is a very nice question. So I do face some of the common problem. Suppose, let me explain you with an example. A patient come to me with a pain in some teeth or slight sensitivity in one teeth. So in this situation, I will treat that and I will fix that particular tooth. So once I fix that, I also tell him that there is another 3 or 4 teeth that has to be filled. Then patient will tell doctor, I am going to vacation next month. I will fix it there. So I tell, yes, fine, that's okay. You can save your bucks, get it done. But I tell you, please get it done. But ultimately, the same patient walks to me after 6 months, stating the pain in another teeth. So this particular teeth has progressed, and now it's already massacred. So it started paining.
Okay.
So these are the common things. Then I ask the patient, he tells doctor, my trip was cancelled, or he went to his home country, but there was no time. So these are some of the main mistakes. Knowingly they do that.
Yeah, delaying.
Delaying to address
Yes. Concerns.
Yes,
Okay.
this is the main mistakes they do. So I always advise to, when we notice that, when somebody has told you that, it has to be fixed at
Right.
the earliest.
Right, because otherwise, if you delay it further,
Yes.
then the next action might have to be extracting the tooth.
Or root canal treatment,
root canal.
which might cost you more.
Yes, definitely. Also, in terms, because I've already mentioned extraction, is it important to replace an extracted tooth?
Yes. Now, any particular teeth that has been removed needs to be replaced,
Okay.
except wisdom teeth.
Okay.
So why that particular teeth has to be replaced? Because the patient has to masticate. The masticatory force should be uniform on either side. For example, if he is missing on the right lower teeth,
Okay.
he will switch on eating on the left side. So there will be improper balance. He need to replace that for the proper balance, and it's like he has to use both the sides. It is just like we are using both the hands, both the legs. Similarly, all teeth should be functional.
Oh,
That is-
actually that's the first time that I've
That
heard of
is the main reason.
because I've been using only like one side.
See,
I'm not very I'm not conscious about it, but I'm just you talking about it made me realize.
yeah.
how
Secondly,
I do my bite.
secondly, what happens if there is a missing teeth? There is a tendency for the other remaining teeth to move. That is
Right.
called tooth migration. So that tooth will move here and there,
Right.
ultimately causing the spacing. Again, patients comes to me to fix the spacing. Again, that has to be dealt with the braces or any other treatment plan.
Right.
So
right.
this is the main thing, that we need to replace a missing teeth, except wisdom teeth. Wisdom teeth may not be, is not necessarily we have to replace the wisdom teeth.
How do we replace a missing tooth? I mean, is it through implants or any other procedure?
Yeah, now this is a long chapter. It's a big chapter. We need to, let me just simplify that.
Right.
So we are going to replace the missing teeth either by removable prosthesis or fixed prosthesis or implants.
Okay.
So removable prosthodontics, like removable prosthesis, we just, our Kabayan
Right.
friends will be understanding prostheso. If I
Prostheso,
tell
yes.
the word prostheso, they will be aware of that.
You're
So that
familiar
has,
with the Filipino term.
so that prostheso needs to be removed in the night. Whenever they are
Yeah.
sleeping, they need to be removed, and the remaining time they can be used. So this is called as removable one. Then the other type is fixed one. For example, again the word jacket.
Right.
So the terminology is crown or bridges. So it is fixed. It is something that we give fixed. Patient cannot remove that. It will be fixed for that. So this is the second terminology. The third one is, of course, implants. Again, out of this, it depends on like patients, on which tooth has to be replaced.
Right.
Patient health also counts. So there are so many criteria that we have to consider and then give them the plan.
Okay. We are having very interesting conversation right now. We will just go on a very short break, and then afterwards, of course, Dr. Anup will be discussing about orthodontic braces. And I'm sure that many of our listeners right now would like to know more about that, because that will bring out the best smiles in us, right? So all you have to do is to keep your frequencies locked in only here on Kabayan Radio 94.3. We'll be back here at The Doctor Is In.
Is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
Live, online, on air, and on ground. Kabayan Radio 94.3.
You are listening to Kabayan Radio 94.3, the first and only Filipino radio station in Qatar. We are taking radio to a whole new level. Kabayan Radio 94.3. 3 years and counting.
3 years on the airwaves. Kabayan Radio continues to bring you closer to the music you love.
I need somebody who can love me.
To the entertainment you love.
To the information you need.
And to radio advertising you deserve.
Over analog
And multi-digital platforms.
This is Kabayan Radio,
94.3 FM.
the first and the only
Filipino radio station in Qatar. Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
Welcome back to The Doctor Is In, and of course you are still with me, Kenzo, and joining me here at Kabayan Radio Broadcast Studio is Dr. Anup of Gulf Medical Center.
Hello,
Gulf Dental Center, sorry.
Hello, Kabayan friends. Welcome back.
And just before we went on break, we said that we are going to discuss about orthodontic braces. So what is an orthodontic braces?
Okay, now this is my specialty. After general dentistry, again we do 3 years course to become a specialist. In dentistry, we have several branches again. So one which do or deals with the braces is known as orthodontist. So this is the first specialty in the dentistry, and this is called as orthodontist. So orthodontists are the one who deal with the correction of malaligned teeth with the help of braces.
Okay. So what's the very main purpose? It's just really to align the teeth, or
Now there are different criteria. It might be functionally, or
Okay.
it might be aesthetic, cosmetic wise.
Right.
Both, I do see both the patients to get the corrected for the functional purpose as well as for the cosmetic purpose.
I'm curious, how much percentage of people are doing it for cosmetic purposes?
No, cosmetic, of course, everyone likes to have their own smile. Smile is something that brings inner confidence for them.
Right.
So we cannot consider like improve the smile as cosmetic.
Right.
Even though it is cosmetic, but you can take it as a
Right.
functional way.
Right.
So it builds the patient confidence when they smile.
Right. And of course, we are talking about orthodontic braces and aligning of teeth. There are certain stages in our lives wherein, like for example, as we grow, we have permanent teeth. So what is the best age to have orthodontic braces?
Okay. Now this is a very common question that all my parents will be asking. Doctor, let me know what is the exact age for fixing my daughter or son teeth. So to answer this, the right age is around 11 years to 13 years.
Okay.
Wherein you find all the teeth, permanent set of teeth. That is called as permanent dentition.
Okay.
So there is a milk teeth as well
Right.
as permanent teeth. So once all the permanent teeth is erupted, then we can start with the braces. So
Okay.
usually we give a time range that is 11 years age to 13 years of age. This is one thing. Another thing, there is something called interceptive orthodontist, wherein we do some small correction for the crooked teeth so that the severity is reduced.
Okay.
So may not be wait till until 13 years. For example, in interceptive orthodontist, we give some myofunctional appliances. So what is this appliances? Some patients may have, for example, the jaw.
Right.
The lower jaw is called as mandible. He might have prognathic mandible or forwardly placed mandible. In this situation, we need to reduce the growth of that mandible.
Okay.
We give a appliance that is called as myofunctional appliance. At this certain circumstance, there is no need for us to wait till 13 years. Catch them young. When where is the diagnosis, we need to start the plan.
Okay.
We need to start with the fixing that. So we can do interceptive orthodontist, wherein small cross bites, small
Right.
spacing, some habits. There is several habits that has to be broken at the earliest. If not, it will manifest
What kind of habits are you
Tongue-
referring to?
tongue thrust, nail
Okay,
nail sucking, mouth breathing. So many habits are there that has to be intercepted at the earliest.
Okay.
We give separate appliances for all these things. So this all comes under interceptive orthodontics, wherein we concentrate both dentally, that is tooth, as well as skeletally, that is the jaw,
Right.
which
okay.
acts as a supporting or foundation for the teeth.
Okay, so the ideal age, as we were talking about earlier, is between 11 and 13.
Yes.
Once they have the permanent teeth. Although it would still have to depend on the case that we are trying to resolve.
Exactly.
So, yeah, it can be even earlier. than 11
Exactly.
years old. So, what are the types of braces that one can get?
Yes, now we have several types, namely straight wire mechanism and then self-ligating mechanism, and there is something called aligners and there is something called lingual appliances. So coming to the first one, that straight wire mechanism, again there is a different types. There is metal and
Right,
ceramic
ceramic,
braces.
yeah.
So metal and ceramic, which is very common in most of my Kabayan friends, they are aware of that. Ceramic, the advantage of ceramic is it's
Less
less
visible.
visible.
Yeah.
Exactly. It's less visible, and the patient, when he's speaking or interacting with any of them, they may not noticeable. So this is the main advantage of ceramic braces. Then coming to the self-ligating,
So the first one, sorry, for the first one, is this the one that you have to go and visit a dentist like every few weeks so that they would have to adjust the wires?
yes, in all the
Okay.
mechanism, you need to have a monthly follow-up.
Okay.
In all the, irrespective of whatever mechanism,
Okay.
there is a need for the patient to have a monthly regular checkup.
Okay.
If not, it might get worsened.
Okay. Okay. And as you were mentioning, the second type.
That second type will be like self-ligating brackets. So what is self-ligating brackets? In these bracket system, the wires get locked in self and it places continuous force. That is, light continuous force will be applied to the teeth. Henceforth, the movement will be very regular and you can expect some early results compared to the straight wire mechanism. Since self-ligating is the latest advances, the treatment duration can be reduced.
Okay.
Depending on the severity. If it is too much of crooked teeth, we can go with the self-ligating to reduce the duration of the time.
All right.
And then we also have lingual braces. In lingual braces, everything will be done backside of the teeth.
Right.
That is behind tooth. So nobody can make out that the patient is having any brackets.
Nobody will be noticing it.
Noticing it.
But
Everything.
isn't it going to be much more challenging?
Of course, yes. It might be challenging for both patient as well as orthodontist, but slowly they get used to, they get accustomed to it. That's the reason they have find out.
And that type of braces would be self-ligating or
Yes, of
straight
course. In
wire?
that there will be self-ligating as well.
Okay.
There is different mechanics. It can have both the mechanics.
Okay. And you were mentioning about the duration of the braces earlier. So usually how long does a one person need to have these braces on?
Yeah, before coming to that one, let me explain you the last one. That is
Oh,
called
okay.
aligners.
Sure.
Aligners are something wherein the most common the brand is called as Invisalign.
Invisalign.
All are aware of Invisalign. They come to me directly, doctor, I need to go with Invisalign. Invisalign is just a brand. So it is a sort of aligners. We have got different brands.
Right.
So in this mechanics, we are not going to use any sort of metal brackets or any sort of brackets. It's just that we give some aligners. They have to wear it 20 hours a day approximately, and then slowly automatically it gets keep on fixing.
Right.
Maybe the duration depends on the severity of the condition.
Right. And these are the transparent.
Exactly, transparent resin materials wherein the patient will be using.
Okay.
So going back to your question,
The duration.
duration again, duration of the treatment depends on the severity. In most of the cases, we going to remove 2 or 4 teeth for the spaces. In those circumstances, we can expect the duration around 1.5 years to 2 years, wherein the patient, again as I said, needs monthly follow-up. Patient has to visit orthodontist monthly once. And in another scenario, wherein we don't remove any teeth, there is no extraction. That is called, there is no therapeutic extraction. In that, even we can expect within a year, maybe 6 months to 1 year is sufficient.
Okay.
So depending on the severity, depending on whether we are extracting or not extracting, the duration will be
And also
decided.
depending on the type of braces. That you're going
Yes,
to
of
have.
course, of course.
All right. What are the do's and don'ts when you have orthodontic braces?
Now, when the patient is already having braces, now utmost concentrating thing is he needs to maintain his oral hygiene. That is, he needs to brush properly. He needs to brush twice or thrice in a day. He need to use a specially designed brush, that is orthodontic brush. Also, there is a brush called interdental brush, wherein you can remove the small debris in between teeth.
Right.
So these things has to be considered. And after each meal, he needs to go for mouthwash. Along with that, he needs to concentrate on the gums, because when there is a orthodontic force, there is a chances of gum getting swollen. So
Right.
this has to be counteracted by gum massage using some ointment or finger or some gum astringents.
Right. Right.
Lastly, we need to take also clean our tongue with the help of tongue cleaner. Coming to the diet portion, we generally ask patient not to bite anything hard. Not to bite anything hard. They can make that into pieces. For example, apple. Let them not bite directly. Let them make it into pieces. Cadbury's or any other chocolates.
Or nuts.
Let them make it into pieces and then have it.
Okay.
What happened if they directly eat it? The chances of eating the brackets and
Right.
it might break, which in turn might cause uneven tooth movements.
Right. Right. Right.
So these are some of the precautions that has to be taken when the braces is there.
Yeah, I do agree with you that you really need to take care of your teeth when you have braces, because when I had braces before, the calcification is actually quite faster than how it normally should. I don't know if that's really a normal case or if
No,
my
it
case
mainly depends on your brushing technique. You're not concentrating. It's not just your brushing. You need to stand in front of the mirror and concentrate each tooth and remove the debris so that there will be no accumulation.
Right, right. Another question, because I've seen a lot of people who had braces for a long time and they are wearing their braces for aesthetic purposes. Is that okay to,
Yes, I do agree with you, but it is not at all recommended to wear the braces for fashion purpose or cosmetic purposes. Of course, in case if they want, they can just use it for a month or maximum 6 months. Why? Because it causes, first thing is halitosis, that is bad breath. Second thing, as I said, it might cause traumatic injuries to some of the gums or some of the intraoral tissues. So lastly, there might be more of calculus deposit, which in turn might cause reduced bone levels.
Okay.
So, which in turn causes the tooth mobility.
Okay.
So, it is not at all advisable to have braces
Yeah.
for
Because I know a lot of people doing that, especially for Filipinos.
mainly they
And using it for fashion purposes.
Yeah, they use that. I have seen that. They come to me, they tell that I want braces so that I can go with a new TikTok video. But that is not advisable, my dear
For a
combined
TikTok.
friends.
Well, anyway, what happens after you have your, alignment? So it is already like a perfect set of teeth, and the braces have been removed, been taken off. So what are the things that the person should do?
So now, the next phase after the active treatment, that is with the help of braces, we generally recommend retainers. So retainers, as the name suggests, it is something going to retain the corrected tooth in its position. If you don't follow the retainers, again the tooth has tendency to revert back to its previous position. So to avoid all these unwanted movements, we need to wear retainers at least for 6 months to 1 year, depending on their particular orthodontic guidance. Now again in the
So as you were mentioning, once it has already been moved to its like perfect alignment, there is like no guarantee that that will stay in place, and that it could return to its original place before you had your braces. What is usually the reason why it goes back to its original place?
the reason is, to be more specific, these teeth are surrounded by gingiva, which are made up of fibers. These fibers are elastic in nature.
Okay.
So what is the basic nature of elastic? So when you stretch it, it's going to come back to its normal position.
okay.
When you stretch and keep it there for few hours or few days, it loses its elasticity. The same mechanics hold good here.
Okay.
So you need to keep a moved teeth in its position for a long term.
Long time, like
So
years.
that, yes, not
okay.
year, depending on the cases.
Okay.
In that scenario, it is going to lose its elasticity, and in turn, you cannot expect any unwanted tooth movements.
Okay. So that's why it's important to wear retainers after you have your braces.
Exactly. That-
What kind of retainer is advisable to use? Because there are also different types of retainers, right?
Now, coming to the different types of retainers, we generally classify into fixed and removable. So removable, we usually can be removed by patient when the time of food, or if he have anything hot beverages, he has to remove the retainers. A fixed is something which is fixed, a small wire is fixed to the teeth, wherein patient cannot remove the retainers. This is usually advisable. I mean, fixed retainers are usually advisable when we do some spacing cases. When we close some spacing, that is diastema cases, in all those things, we generally recommend fixed retainers.
Okay. Okay. Now, I do have this question because a lot of Filipinos who are here in Qatar are very hesitant to go to the dentist or to have their braces adjusted by another doctor, because they are saying that they had it done in the Philippines and that what they would want to do is for their braces to be adjusted by the same orthodontist. So is this something that would be okay for them to keep doing?
Now again, depends on the criteria. If the patient is already having braces for long term without any active movements, then it's just a waste of like the braces is just idle. It's not serving the purpose. In this scenario, either you need to move forward, that is active treatment with the help of the local orthodontist who is available, or to remove the braces.
Right.
So these are the criteria you have to think of.
Okay. Is there any other concern or any other tips that you would like to advise everyone who would like to have orthodontic braces, or those who already have orthodontic braces?
Okay. Now, I do see many of my patients having braces from their home country, that is Philippines or many other GCC countries. They are already having braces, So they come to me for adjustment. Now in this scenario, I always prefer to get a referral letter wherein the date of when it started and the treatment plan, as well as the prescription of the brackets. So this treatment plan prescription should be very precise. So always better to get a referral letter so that it will make the job easy for the continuing orthodontist. That's number one. Second thing, we start taking, as I said earlier, we start taking a X-ray, that is OPG, and then we evaluate the present situation of the present status of the teeth. Okay. Accordingly, we discuss again what is the treatment plan, whether we can proceed with the treatment plan, or what is that we have to fix, what is that patient has to fix, whether that can be fixed or not. If it is fixed, how long it will take. So these things we have to talk to the patient prior, and of course at the end we need to explain the charges.
Right, of course, definitely. And I'm sure that many of our listeners and viewers right now are very interested to know more about the things that you can do for them. How do they get to be in touch with Dr. Anu?
Of course, you can, like I am available in Gulf Dental Center, Old Airport branch. So that is located just behind Deering Road, Lulu. So I'll be available. You can call to our landline or mobile number which is available and fix the appointment so that I can see and fix what all your dental problems.
You've mentioned Gulf Dental Center. So how many branches does the dental center have?
Now, we generally have the main advantage of our group is accessibility. So we have got 5 different branches, like 5 specially dentally made for dental speciality. We have a branch located in Gulf Dental Center, Old Airport branch, that is just behind Deering Road. Hilal branch we have got in Duhail, we have got in Accra, and we have got Al Abib branch, that is just near to DFC, Doha Festival City. Apart from this, we have also 2 more family medical polyclinic, wherein gynecologist and dermatologist along with dentistry, we have a family medical polyclinic. So all these can be benefited by our Kabayan friends. So main thing is accessibility.
Right, and of course, apart from accessibility, you also have highly qualified specialists.
Now, in our group, we do have highly qualified. Almost all my dental colleagues are about 10 years of experience. So often, patient can expect the great result, the great treatment plan from our dentist.
Right, and I've been to your dental center before, actually quite a number of times already. And apart from having really good staff and really good specialists, what I can also say is that you have some of the best facilities that there is in Doha.
Correct. Now, the dentistry in majority of in dental clinic, the main advantage in our clinic, we almost all the dental materials are imported. So when we have a good material, good dental material, we can expect a good result. So whatever we use, it's imported. So the longevity or the shelf life will be automatically increased. So this is the another plus point in our centers.
Because all the materials that you use are of high quality.
Utmost high quality, and which are all imported.
And actually not just the materials you use, but also the management has been very, very supportive. And in fact, here at Kabayan Radio, some of my colleagues, RJ Cody, who's here in the studio, have been there. And the management has been, just really focused on maintaining really good service for the people here in Doha.
Yes. See, the leaders always lead them, and the good leaders like our boss, Dr. Abu Zaina and Dr. Muhammad Ilalami, these are the 2 great leaders. They are our boss. They know how to manage the things. And if you have a good leaders, of course, the team is going to be more efficient. So if the team is more efficient, automatically the patient's flow will be good and the treatment will be excellent.
Right, right. And of course, that's what people want to know, that they are going into a particular dental center, into a particular facility wherein they get the best medical professionals,
Exactly.
dental professionals, as well as a really good facilities
Exactly.
and materials that are being used. But at the same time, one other factor that people are looking into is the cost.
Yes.
So, how much does services cost?
Yes,
at
we
Gulf
have a
Dental
fixed
Center?
price. Many of time we do give some special promotions. We generally give 3 months once or 6 months once the promotions.
Okay.
In these promotions, the patients will be having the treatment done almost 50% reduction of our actual cost.
Oh, wow.
So that's again our main reason to choose our centers.
And if in case they are going to have orthodontic braces, that's also something that it can be paid installment,
Yes,
right?
yes,
Installment
yes.
basis.
Now presently we are running promotions wherein minimum of 500 QAR as a down payment can be paid, and the rest can be paid in installments
Okay.
along with the treatment
All right.
as the treatment progresses.
All right.
So these are some of the facilities that we are giving to help our Kabayan friends.
It's something that is affordable, actually, especially here in Qatar. So I do hope that all the Filipinos who are listening and watching to us right now can get to visit Dr. Anoop at Gulf Dental Center. Is there any last messages that you have to our listeners and viewers?
So first of all, thanks for all my Kabayan friends for the listening, and I do wait for you people so that you can visit our center and take advantage of all our dental treatments. Thank you all my Kabayan friends for listening. Thank you, friends.
Is there anyone that you would like to greet on air since you're already here
Yes.
in the studio?
Thanks to all my Kabayan colleagues, Kabayan 94.3, as well as my management, Dr. Mahmood and Mr. Mohammed Robin, for giving us the opportunity. And thank you all.
How about your family? Maybe they're watching right now.
Yeah, I do.
Let's grab this opportunity.
So my parents actually is in India,
Okay.
so they may not be listening.
But
of
they
course,
could be watching us on
yes,
Facebook.
yes, they might. I'll tell them to watch later.
All right, that's good to know. So anyway, thank you very much once again, Dr. Anoop Rudramurthy of Gulf Dental Center. It is a pleasure to have you here in the studio. And we do hope that we get to see you again back discussing more other topics related to oral and dental health.
Sure, sure. Thanks for all your patience and time. Thanks for calling me and inviting me.
Yes.
Thank you all, friends.
And once again, on behalf of Kabayan Radio, I would like to thank Gulf Dental Center for making this episode of The Doctor Is In possible. And of course, with Gulf Dental Center, you are in good hands, and they will be making your smiles brighter. Once again, my name is Kenzo of Kabayan Radio 94.3. Stay safe, keep smiling, be blessed.
Health is wealth. Ask about your health conditions because the doctor